Okay, I want to give you one example of setting up a cancer research landscape, and that's an emerging thing which goes over decades. Let me start with Germany is not the easiest country to do a cancer research landscape because it has a very segmented both cancer care system as cancer research system, and only this is not a comprehensive list. We have private practices which do not exist in many other European countries. They are mandated by law for outpatient care, so hospitals are not mandated for outpatient care. Then we have city hospitals, private hospitals, university hospitals. We have medical faculties performing research. We have non-university research institutions like my institution, DKFZ. We have industry, and we have many other stakeholders in the nation. So my center, the DKFZ, was established 1964 as a national center for cancer research. It is a member of the Helmholtz Association and is funded basically fully by the German federal government through the science minister. And the mission is to perform high-class cancer research, and that was mainly initially in the areas of discovery and early translational research. And DKFZ in 1964 was not founded as a hospital. It was founded solely as a research center. So it does not provide patient care. And that was fine, maybe in 1964, but it was a big problem when more translational approaches in cancer research became more and more needed to make differences for cancer patients. So with increasing importance of translational cancer research in the 1990s, we started to form corporations. And I want to explain you what we did, how we set up networks, and how that shaped the situation in the country. Before I can do that, I want to explain you briefly how the situation is with university medical centers in Germany. We have 36 university medical centers. You see a map there. And they are all financed not by the federal government, not by the health minister of the federal government. They are financed by the federal state governments. And there they are financed through the research minister, not through the health minister. So it's a very particular situation. And CCCs came late in Germany. So in the early 2000s, the first two CCCs were founded as a bottom-up approach, and that was in Heidelberg and that was in Dresden. And then the German Cancer Aid, which is a foundation, the largest cancer foundation in Germany, decided in 2007 to start a competition to increase the number of comprehensive cancer centers, and that was probably one of the most important and successful programs ever run in the area of cancer in our country. And you see that there are now 15 comprehensive cancer centers which are officially accredited by the German Cancer Aid since 2007, and they integrate multidisciplinary care in a wide spectrum, research, education, and outreach. But there was a problem. We had in the university medical centers some basic research. So there were some laboratories with PIs who performed basic cancer research. There was also clinical cancer research, but there was nothing in between, or very little in between. And there was also no money provided to the comprehensive cancer centers which could close that gap. And therefore, again, the federal government with the science minister decided to expand the DKFZ, my institution, to form a network into the comprehensive cancer centers for translational cancer research. And that network was called German Cancer Consortium, and it exists since 2012. And it's basically linking the DKFZ as a core center with 10 university medical centers which have been selected by international peer review, with a specific task to fill the gap between basic and clinical research, accelerating the transfer of new scientific findings in prevention, diagnosis, and treatment, and to provide nationwide a cutting-edge translational research network. And there are some unique features which I think were very important and overall were the basis for the success. One is that from the beginning, it was clearly said this is a cooperative effort. It's not an effort to give better finances to individual centers. It is giving finances to a network. The second is it is long-term institutional funding. So basically this funding is available for the next decades, maybe forever. It is reviewed every couple of years, but it is not stopped. It's not a program which has a time period of 5 or 10 years. It can go on forever. And that's very important in terms of translational research, because we all know that we have long cycles in translational research. And we are able, by that provision of funding, to, for example, install also professorships on a long term in the network, which otherwise on program grants would be completely impossible. So then at all sites, powerful translational hubs were established, and they are synergistic. So it's not the same hub at each site. It's specialized hubs at different sites which work together. There's a joint funding program which is competitive and provides a glue between the different centers. There was from the beginning a strong training program of the next generation of medical and clinician scientists. And there's an interface also to other similar endeavors in Germany, for example, in the field of diabetes or cardiac disease. This all turned out to be very good and was reviewed internationally very favorable, and I think it's an accepted structure now in the country. But we then saw that more and more we have an emerging other bottleneck, and that is early clinical trials, because the German Cancer Consortium, DKTK, provided a pipelines for very good ideas, but this pipeline stopped because things didn't go into early clinical trials, because the funding of the DKTK and also the expertise in the DKTK was not sufficient to provide an answer to that gap. And I show you only one example here, which I think is a very bad example for my country. On the left-hand side, you see IITs, so investigator-initiated trials. On the right-hand side, you see pharmaceutical or industry-driven ISTs. And what we did here is we evaluated the number of trials in a public database from the NIH and evaluated simply how many cancer trials are ongoing in Germany and compared that to a number of other countries, which you see here. And overall, there were last year 242 clinical trials, IITs, from academic pipelines open in Germany out of 9,000 trials in the world. And that's a very low number. And if you do the relative number on the population base, then it's 2.9 IITs per 1 million inhabitants. And if you compare that to other numbers you see there, for example, to the United States, that's a factor of 5 or 4 to 5 difference. And the situation looked similar in the IST world, so in the industry-driven world. And therefore, we identified a couple of years ago this bottleneck and brought it forward to the political room, to parliament and to the ministries, and offered a solution which we called NCT, National Center for Tumor Diseases. And that is a research platform for clinical trials, which is invested from the DKFZ into comprehensive cancer centers in Germany. So we have the DKTK for pipeline research, also for reverse translational research, and we wanted to attack now the bottleneck of clinical translational research, more specific of early clinical research. And that was quite successful with 2 pilot sites, which were funded in Heidelberg and in Dresden. Those were the 2 places which also by bottom-up processes had established the first comprehensive cancer centers in Germany, therefore they were selected. But then a competition was started in 2019 to expand that to 100 million euro per year by the end of this decade and to involve more centers. So there was an open call, which was international peer reviewed for 4 more sites. And 3 weeks ago, that competition was over. It was clear that the expansion will take place. You see that there will be a West place by Cologne and Essen, or a Berlin place in addition to what we had before. And in those sites now a clinical research platform, including professorships, including personnel, but particularly a large competitive funding program for clinical trials will be established and will be financed. For a network again, it's again the network approach. It's one NCT, not several NCTs, with DKFZ as a core center and university medical centers as partners at the local sites. The last component, which is emerging now and which we are working on in the moment, is prevention. We had in the morning several thoughts about prevention, and prevention research is bad actually in Germany as in many, many other countries in the world. And we had here founded a strategic partnership together with the German Cancer Aid, the foundation, to provide in this decade a national cancer prevention center. And that takes a concept of a comprehensive cancer center towards cancer prevention. So it will bring under one roof basic research, discovery research from biology or physics or data science. It will have applied research, interventional trials, for example, in prevention or in early detection, policy advice as a very high level, and citizen involvement or patient involvement in the whole endeavor. So it is really a comprehensive cancer center program brought to prevention. And that also will have a national rollout, a digital national rollout, and a physical national rollout. It is in the moment completely financed by private funding. Luckily, we were able to attract donors which were willing to provide big money into the whole scenario. There will be a main building which we currently establish in Heidelberg, a new building, and there will be branch offices over the country in the coming years. And with that, I want to stop. So this is something which I will not explain in detail. I showed you with my first slide that we have a hugely segmented system in Germany. And over the past 10 years or 15 years, and ending probably in the early 30s, we will be able, despite of the fact that the system is extremely segmented, we will be able to bring together the different stakeholders under different ministries, under federal government with state government, in those areas of translational research, of clinical research, and of prevention research. And that is what we intended to do to form our landscape in our country. Thank you very much.